So the conclusions of the genetic AF trial were that it missed its primary endpoint in the overall cohort, but showed strong trends towards positivity, which meant a benefit associated with an investigational beta blocker called bucindolol in an identifiable subgroup of patients. The genetic AF trial was conducted as the first genetically driven pharmacological trial in cardiovascular medicine, specifically in heart failure, in order to see whether or not this investigational beta blocker bucindolol could reduce the risk of recurrent atrial fibrillation or atrial flutter in heart failure patients. So the study had a relatively complex design. First of all, patients had to undergo genotyping, and if they had a particular genotype that was specific for the beta-1 adrenergic receptor 389 arginine mutation, they were eligible for the study. This is a genotype that is associated with enhanced adrenergic activity in heart failure patients, and in a prior study called the Beta Blocker Evaluation of Survival trial, was a treatment with bucindolol was associated with a marked reduction in the risk of atrial fibrillation. Patients were randomized to either bucindolol or to the active comparator metoprolol in a double-blind fashion, and they were followed for a primary endpoint of all-cause mortality or recurrent atrial fibrillation or atrial flutter. So the results of the study showed that there was no difference in outcome, that is all-cause mortality or the recurrence of AF or atrial flutter, between bucindolol-treated patients and metoprolol-treated patients. But there were some curious differences based on geography. In 4 countries, which enrolled 2/3 of the patients, bucindolol did better than metoprolol. In 2 countries, metoprolol did better than bucindolol. And when we drilled down on that observation to discern what made the difference, it turned out that the difference seemed to be related to the duration of atrial fibrillation relative to the duration of the heart failure. In patients whose heart failure onset preceded the onset of atrial fibrillation or occurred around the time of the onset of atrial fibrillation, bucindolol was better than metoprolol. In those patients who had atrial fibrillation for a substantially longer period of time than they had heart failure, bucindolol was no better than metoprolol. So it appears that how you get to this combination of heart failure and AFib makes a difference, and the patients that are primarily heart failure patients are those who seemingly benefit from treatment with bucindolol. Yes, I think this was a fantastic phase 2 study. It really did what phase 2 studies are intended to do, and that is to give us insight into patient selection and the design of a phase 3 trial. And so I think based on the results of the genetic HF trial, I'm hopeful that this therapy will move forward in a redefined, refined patient population.